Okay, respiratory system part 1, a short, brief overview of the upper respiratory conducting airways. Okay, so the functions of the respiratory system are gas exchange, regulation of blood pH. The respiratory system also contains receptors for the sense of smell, and it filters the inspired air, produces sounds, and rids the body of some water and heat in expired air. So when we look at the respiratory system, we have the upper respiratory system, and then you have the lower respiratory system. Let's talk about the upper respiratory system, and that's what this video is focused on, the upper respiratory system. The next one will be the lower, and then the third one will be in the exchange of gases. So upper respiratory is the nose, pharynx, and associated structures. And then the lower respiratory conducting airways are the larynx, trachea, bronchi, and the actual lungs. So here, this is a pretty simplified image. There's a lot more stuff to put in here, and we'll go over it. But if you look at the upper respiratory area, it includes the pharynx. So everything here, this is all upper respiratory from here to there. Once you hit the larynx and down, that's all lower respiratory, okay? So the functional divisions include the conducting portions and then the respiratory portions. Like again, I said, this respiratory portion will not be covered in this video, but the next one. And even in this conducting portion, we're only going to focus on the nose and the pharynx today. So each one of these interconnect, these cavities and tubes interconnect both the outside and with the inside of the lungs. And the goal is going to be filtering that air as it comes in, warming it, moistening it, and conducting it into the lungs. So these conducting areas are the nose, the pharynx, that's for the upper respiratory. The lower respiratory is the larynx, trachea, bronchi, bronchioles, and terminal bronchioles. Now, when you get into the respiratory portion, that's just on this was just conducting, right? This list here. Now, in the respiratory portion, we have the tissues within the lungs where gas exchange occurs. You have these things called the respiratory bronchioles. See, you have terminal bronchioles here. You have bronchi, bronchioles, and terminal bronchioles in the conducting portion. And then the most distal aspect will have these respiratory bronchioles with alveolar ducts, alveolar sacs, and the specific alveoli. Very important to break that down in your mind as you look at the anatomy of the lungs, especially for a lab portion, right? Identifying each individual aspect there. So when we look at the upper respiratory, we have the internal nose and the external nose. In the internal nose, the lateral walls will include the ethmoid. These are the bones, the maxilla, the lacrimal, the palatine bones, and the inferior nasal concha bones. The floor of the internal nose is the hard palate, which consists of the palatine and the palatine process of the maxilla. So when you look at the external nose, before you came into the internal nose and looked at those bones, so to speak, as we look at it, we have this breakdown. You know, you have this root, the dorsum, the apex. These are called the nares, you know, when you flare your nostrils. In the center is the nasal septum, and they call this the alar right here. So the two openings are the external nares or nostrils. The function is warming, moistening, and filtering incoming air. You can detect olfactory stimuli. That's smell, right? Because along the membranes in there, the mucous membrane of the external nose, starts having some olfactory stimulus olfactory receptors within the membrane. Now, your nose can actually modify speech vibrations as they pass through the large, hollow, resonating chambers. You think of Barbra Streisand. She never had a nose job. Maybe you don't even know who Barbra Streisand is, but she never had a nose job because she was afraid that was going to change the sound of her voice. And she does have a very nasal voice, right? And she can like resonate that sound. So the term resonance refers to prolonging or amplifying or modifying a sound by vibration. Okay. So the external nose has a cartilage framework. It consists of a septal cartilage and the lateral nasal cartilage and the alar cartilages. It's the supporting framework of bone and hyaline cartilage covered with muscle and skin lined with mucous membrane. The frontal bone, nasal bones, and maxilla form the bony framework. Now we get into the internal nose, and we'll see a picture of this in a moment. It's a large cavity in the anterior aspect of the skull. It lies inferior to the nasal bone and superior to the mouth. There's something called the internal nares or the conae, which provide communication between the external nose and the pharynx. There are ducts coming from the paranasal sinuses, and the nasal lacrimal ducts also open into the internal nose. So the nasal cavity, the space within the internal nose. The anterior portion just inside the nostrils is called the vestibule. When you walk into someone's house, like in the city or Queens, sometimes you have these houses with a front door and then there's another door. You come into this little, like it looks like a little, I don't know, it looks like almost an outhouse on the front of the house, you know, and then you step in in the doorway there, and then there's another door. So you're like in the vestibule. So just entering the nose is the vestibule. So as you enter right here, this is the vestibule right here. Oops. And then the nasal septum divides the right and left. It's primary hyaline cartilage, but also there's a tiny bone called the vomer that helps to create that separation. And then you have the perpendicular plate as well. Air filtration. The arrangement of the conchae. What's the conchae? Those are part of what? Those conchae are part of bone, right? The arrangement of the conchae and metastasis increase surface area in the internal nose. It traps water droplets during exhalation to prevent dehydration, and the olfactory receptors line the superior nasal concha and the adjacent septum, and they're called the olfactory epithelium. And so you have olfactory receptors embedded in that mucous membrane there. The inspired air is warmed by blood in the capillaries in that membrane. Mucus secreted by goblet cells moistens the air and traps dust particles. And the cilia move the mucus and trapped particles towards the pharynx. Now, you know, when you're getting exposed to something, it causes your nose to get very runny. That's a part of the process to try and help prevent yourself from getting infections, right? Remember, we just talked in the last test about how tears can actually remove or reduce microbial growth, right? But you also have cilia here. So the tissue here in this part of the nose is actually pseudostratified ciliated columnar epithelium. And cilia have protein motors. They use ATP, and the cilia literally move things along and help the trapped particles to be pushed back towards the pharynx to be swallowed or spit out. So the pharynx has actually got three parts, three components: the naso, oro, and laryngopharynx. The pharynx or throat is a funnel-shaped tube about 13 centimeters long. It starts at the internal nares and extends to the cricoid cartilage, the most inferior cartilage of the larynx. Its wall is composed of skeletal muscles and is lined with a mucous membrane. Here it is. Let's look at this. This is a nice image because it really clearly shows the parts of the pharynx. So this was the external nares here, internal nares in here, right? And this would be internal nares right about here. And then here's your nasopharynx. See how it stops at the opening of the mouth right here. So you have this nasopharynx starting from the internal nares to the oral aspect, or the oropharynx. And then you have the oropharynx, which is where the throat is, opening of the throat, up to where the larynx is. And then you have the laryngopharynx down to the cricoid cartilage. So the pharynx is basically a passageway for air and food. It has a resonating chamber there, basically for speech sounds. It houses the tonsils, and we saw those tonsils in the last test, and you're going to see how that pharyngeal tonsil, way up high, is bordered on either side by the eustachian tubes. Okay. And then the nasopharynx is the superior aspect of the pharynx. It extends from the posterior nasal cavity to the soft palate. There are 5 openings in its wall. 2 are the internal nares. 2 are those eustachian tubes, or auditory or pharyngeotympanic tubes. So your ears are actually draining right into that spot, and 1 opening to the oropharynx. The pharyngeal tonsils are right in the middle, right? And then you have the 2 eustachian tubes coming down alongside it. And the pharyngeal tonsils right in the middle to receive any of that yucky stuff that's draining from your ears, right? The nasopharynx is lined with pseudostratified ciliated columnar epithelium, and it moves the mucus down towards the inferior part of the pharynx, and the eustachian tubes help to equalize air pressure between the pharynx and the middle ear. I had a patient that just came back from Aruba, and she said on the trip she couldn't equalize her ear and still hasn't equalized. So I worked on her neck, and I literally adjusted her ear, believe it or not. Did you know you can adjust an ear? Yes, you can. Okay. So oropharynx is the intermediate portion of the pharynx. And so that's in between, the middle, right? It extends from the soft palate to the hyoid bone. There's 1 opening, and that's called the fauces. That's the throat, the opening from the mouth. It's a common passageway for both food, air, and drink. You have the palatine and the lingual tonsils found in this area. Okay. This area now, the epithelium changes because now you're going to be having food come in. So you have this non-keratinized, stratified squamous epithelium to withstand abrasion from food particles. Otherwise, you'd bleed every time you ate, if it was just a single layer, right? The laryngopharynx is below this area now, so that's the inferior portion of the pharynx, sometimes called the hypopharynx, below, right? And it opens to the esophagus posteriorly. So you have 2 tubes now. You have 1 posteriorly is the esophagus, which is the food pathway, and the 1 anteriorly is the larynx, which will become the trachea. Both a respiratory and a digestive pathway. And this is also lined with non-keratinized stratified squamous epithelium. Here, let's look at it. So this one tells you it's nasopharynx. There's your nasopharynx. This is telling you it's the oropharynx, right where the mouth opening is, right? And this one is the laryngopharynx, where the larynx is. So let's see it here. Can we identify it here? Which one is the nasopharynx? I would be from here to here. That's your, let me change the color. Might be better if I change the color. From here to here is the nasopharynx. The oropharynx goes from here to here. That's oropharynx. And then the laryngopharynx, excuse my French. The laryngopharynx goes from here to, let's see, I guess right about here, right? Okay, so you can see some of the structures in here. Here's the opening of the eustachian tube. Here's your pharyngeal tonsil. So you have 1 on either side, ear tubes coming down, right? Auditory tube or eustachian tubes. And now the soft palate, this is the soft palate. We talked about the hard palate. This is the hard palate right here. And this is the soft palate. And that's what actually gets thickened in people with, sometimes people who have sleep apnea. This soft palate drops down or becomes congested with lots of mucus or whatever, or swollen, and it can close off the airway when they're trying to sleep. And so that's usually an issue for people with sleep apnea. And there's the oropharynx right here, where the mouth is coming in, right? and the food is coming there. So it changed from the pseudostratified ciliated columnar epithelium up here to now you have this keratinized form all throughout the mouth area, in your cheek and so on, and in the back of your throat. And notice the level of the spine. This is C1 right here. This is C2 right here. Okay, and this is your skull right here. And your brain is coming down through here, right behind that area. Scary spot, huh? And now we look at the laryngopharynx, and you see this, larynx, right? This is all part of the larynx right here. And it has cartilage. And you can see it has an epiglottis up top, and then it has the thyroid cartilage, and then the cricoid cartilage, and then it becomes the trachea. So anteriorly is the trachea here. Let me just change the color. This is all airway right here, and then posteriorly is the esophagus where the food comes down. So what happens is this epiglottis, when you swallow food, the flap will come down. It's a elastic cartilage, so it can be very flexible and create a flap to cover that. If something was to go this way, the reflexes in your voice box area and the opening, the glottis, would cause severe reflex of choking and coughing. Right? Then if something went all the way down, we'll see where it usually goes to when we look at the lungs as they spread out, as the tubes spread out. We'll be going over that later.